I'm Dr. Ken Landau. Thanks for watching. Let's talk about diazepam. Diazepam, more popularly known as Valium, is a benzodiazepine. It was patented in 1959, launched in 1963. The patent ended in 1985. Now there are more than 500 different brands available. Valium was the first drug to reach $1 billion in sales, and even though it's about 70 years old, it's still the 112th most popular drug, most commonly prescribed drug in America. It's on the World Health Organization list of essential medicines. It was the top selling drug every year from 1968 to 1982, and it peaked in sales in 1978 when it sold more than 2 billion pills. Among the other benzodiazepines are Librium, then there's Xanax or alprazolam, that's currently the most popular, and clonazepam or Klonopin. Then also included in the family are Ativan or lorazepam, of course Valium, diazepam, and then we have temazepam or Restoril, and we have Serax or oxazepam. The family, used for its anti-anxiety effects, sedative, muscle relaxant effects, seems that they have anticonvulsant activity, and they induce a certain amount of amnesia. Now, the indications for diazepam or Valium are management of anxiety disorders, but not for everyday stress. It can help with alcohol withdrawal, the acute alcohol withdrawal, treating the acute agitation or the tremors or impending DTs or hallucinations. It's an adjunct for skeletal muscle spasm relief, can help the relief of muscle spasm, joint problems, secondary maybe to trauma, maybe spasticity due to upper motor neuron disorders like cerebral palsy. Seems that it may be used as an adjunct for people who have convulsive disorders, not as the sole therapy. Indications off use can help in benzodiazepine withdrawal, and that's because of its long half-life. So it's easier to discontinue the diazepam than it is some of the short-acting drugs like Xanax or alprazolam, used for certain sleep disorders, restless leg syndrome, and it can be used as a pre-medication to induce sedation and amnesia before a surgical procedure. Can be used to treat the complications of taking too many hallucinogens or stimulants like LSD or cocaine or methamphetamine. Short-term use may be used for insomnia and can be used for treatment of tetanus or even status epilepticus, where a person has a series of seizures one after another. However, intravenous lorazepam seems to be better than intravenous diazepam for this particular purpose. Now, unfortunately, tolerance develops within a period of about 6 to 12 months after you use it for seizure disorders. But even so, it might be useful for seizures from drug overdoses or chemical exposure like sarin or VX or the organophosphates. Military uses it. It gives soldiers who might potentially be exposed something known as the CANA kit, that stands for convulsive antidote and nerve agent. It can be used for prevention of oxygen toxicity in people who are undergoing hyperbaric oxygen therapy, used sometimes for febrile seizures, and even for eclampsia. Eclampsia if intravenous magnesium and control of the blood pressure doesn't work. But most of the studies have been done for less than 4 months. Orally, it's available in multiple forms, either 2 milligram, 5 milligram, 10 milligram. It's available as an intramuscular, intravenous injection, or can be used in the nose, on the buccal mucosa inside the cheek, or can be rectally administered. Now, it has a black box associated with it. So you're not supposed to combine the benzodiazepines and the opioids, because that could lead to profound sedation, respiratory depression, coma, or even death. So if you happen to need to take the two together, you should really limit the dose and limit the duration. And it should be reserved, the combination, for people who have inadequate relief from all the other options available. And the same situation occurs with alcohol and with the other sedating drugs. Well, some people should not take the diazepam or the Valium. Those people are hypersensitive to it, of course, or a pediatric population less than 6 months of age because they don't have the good drug metabolizing enzymes, people with myasthenia gravis or severe respiratory insufficiency, people who have liver insufficiency or cirrhosis, people who have sleep apnea, and people who have acute angle closure glaucoma. It's okay if you have the open angle glaucoma, but not the angle closure glaucoma. Shouldn't combine it with the narcotics or opioids or alcohol. People who have autoimmune conditions with marked fatigue, and people who have a suicidal tendency ought to stay away from the drug. The drug works on a GABA receptor in the brain. Now, GABA is an inhibitory neurotransmitting substance. The receptor is extremely complicated. It has 5 parts, 2 alpha, 2 beta, and 1 gamma part. Those are the subunits. Now, the alpha and the beta and the gamma have multiple different choices, and that leads to different effects in different individuals. So the alpha-1, as an example, the alpha-1 receptor, well, it has sedation and amnesic effects, maybe a little bit of anticonvulsive activity. The alpha-2, that's the muscle relaxant. The alpha-3 and 5, a little bit of muscle relaxant. And the alpha-5, again, has some temporal and spatial memory effects. So in micromolar amounts, it binds to the calcium channels and changes the calcium channels, also changes the sodium channels. High binding affinity there is probably responsible for the anticonvulsant effects. The drug can also decrease prolactin secretion in rats. It decreases the histamine turnover. Once you take the drug, probably somewhere between 90 and 100% is going to be absorbed. The time to the peak concentration is going to be somewhere around an hour, hour and a half. Could be as little as 15 minutes to up to 2.5 hours. The absorption is going to be delayed and reduced. If you take the drug with a fatty meal, going to be reduced by about 20-30%. So if you happen to take it with food, the lag time is going to be an extra 45 minutes to an hour or so. So the peak plasma concentration, if you take it with food, is going to be about 2.5 hours versus only about an hour, 15 minutes if you take it with food. Once it gets into the system, it's going to be bound to the proteins in the system, which means it's not going to be in an active form in about 98% of the product. If you happen to be over age 65, the elimination half-life, well, that's going to be increased by about an hour for every year of age that you gain. So if we look at the half-life in a 20-year-old individual, it's going to be about 30 hours. So remember that. The half-life is 30 hours. So you take the pill right now, you still have half of it left about 6 hours later tomorrow. So the elderly individuals are not going to be able to metabolize enough of it. So if you continue to take it, it's going to build up in the system. And in individuals who are over age 65, it's going to take longer for them to build up an adequate steady state of the drug. Well, in the elderly, we're going to get the accumulation. So we need to have, for elderly individuals, the lowest dose for the shortest period of time. And as a matter of fact, the American Geriatric Association says it's potentially inappropriate for older adults. And even some insurance companies say that for those people over age 65 who are given the drug for anxiety, not for the other indications, but for anxiety, well, they want pre-authorization because they're worried that it causes too many problems in older individuals. Well, how about if you're pregnant? What's considered category D, in other words, don't take it because it readily crosses the placenta, and it's suggested that it increases the congenital malformations and developmental abnormalities. And remember, 50% of the pregnancies are unplanned, and the women are often unaware that they're pregnant in the earliest stages. And if you take it in the last trimester, well, then the newborn might have withdrawal syndrome, where there's flaccidity and respiratory problems and feeding difficulties, reluctance to suck. The body temperature is decreased, and that can persist for anywhere as little as several hours to even up to several months. And if we look at animal studies, there's cleft palate and encephalopathy and changes in the cellular immune response and even brain neurochemical and behavioral abnormalities that persist. Animal toxicity also includes liver tumors in mice and rats. They're a decrease in the number of surviving offspring after administration of the drug, whether it's administered before mating or during mating or anywhere throughout gestation. And it crosses the blood-brain barrier, gets in through the placenta. Present in breast milk at about 10% of the mother's blood concentration of the drug. Shouldn't be used in labor and delivery. Can lead to irregular fetal heart rate and hypotonia. In other words, the baby seems to be flaccid, the temperature can be decreased, causes respiratory distress. And remember, the enzyme systems in the newborn aren't fully mature, and that means it's going to be extra long before the drug is metabolized. So breastfeeding and diazepam don't mix. And remember, there's accumulation that goes on with multiple dosing. And there's some evidence that if you continue to take the drug, the elimination half-life is even going to be longer. Now, the medicine seems to build up in the muscle and in the fat, seems to build up in high concentrations in certain fatty areas. Seems also to increase in concentration in the heart. Well, if we look at the elimination half-life of the drug, it's somewhere between 1 and 3 days for the first part of the elimination. It's biphasic, so we have 2 peaks. One takes somewhere between a day and 3 days. The other, for the metabolites, somewhere between 2 and 7 days. And as I said, the children don't seem to have as good a drug metabolizing system as adults. So if we look at individuals between 3 and 8 years of age, the half-life of the drug is going to be about 18 hours. Newborns, it's going to be about 30 hours. And if we look at preemies, about 8 days after they're born, well, preemies, the half-life is going to be more than 50 hours. And if you have cirrhosis, either mild or moderate cirrhosis, the half-life is going to increase by about 5-fold. It's been reported as long as 500 hours. And if you have hepatic fibrosis, scarring of your liver, well, the half-life of the drug can be up to 90 hours. So that means caution if a person happens to have drug use or alcohol misuse. How is the drug metabolized? Well, it's metabolized through a series of different chemicals. The first metabolite is still active. It's called N-desmethyl-diazepam. And that's going to be hydroxylated to Restoril. That's a sleeping pill. And both of those are going to be further metabolized to Serax, which is another tranquilizer. And then the temazepam and the oxazepam, the Restoril and the Serax, they're going to be largely eliminated in the urine. Well, if you take the drug, there are certain side effects that might develop. So a person who takes the drug can expect some drowsiness and fatigue and muscle weakness and maybe some difficulty walking. We call it ataxia, like you've had too much to drink, or some confusion or some depression or some slurred speech or headache or even tremor or vertigo. Some people complain of nausea or constipation, blurred vision, double vision, hypotension, the blood pressure goes down. Can impair your balance, lead to falls and fractures, may lead to amnesia. And if you have the amnesia, that might be accompanied by inappropriate behavior. It can impair your short-term memory and your ability to learn new information, can lead to incontinence, or alternatively to urinary retention, change your libido, and can worsen depression. But some people have a paradoxical reaction, They suffer from stimulation and restlessness, and a hyperexcited state, and anxiety and agitation and aggressiveness and irritability and rage and maybe even hallucinations or delusions, contrary to what you would think with a sedative. And some people taking the drug for convulsions might actually find that the number of grand mal seizures increases rather than decreases, at least initially. And if you stop the drug acutely, abruptly, if you go cold turkey, well, that also increases the risk of seizures, and you can develop some tolerance, but tolerance to the cognitive impairing effect does not seem to develop, nor does it develop to the anti-anxiety effects or even to the muscle relaxing effects, but it does develop to the sedative effect. So you don't sleep as well if you're using it as a sleeping pill. If you continue to take it, well, it seems to lose its effect. There's some loss of response, obviously, with the repeated use. And a person can be dependent on the drug, can develop either a physiological or a psychological dependence, especially if you're prone to either alcohol or drug abuse. And then, if you've been taking the drug for a while, and you try to get off of the drug, try to withdraw, well, then you can have some side effects. Side effects are the same as the barbiturates. You can suffer from insomnia and tremor and abdominal and muscle cramps and vomiting and sweating. Some people complain of headache and muscle pain and extreme tension or anxiety or restlessness. Some people complain of confusion or irritability. And whatever the underlying problem is that you were using the drug to treat, well, that could rebound. Some people complain of numbness and tingling and hypersensitivity to light and to sound, and some people develop hallucinations or epileptic seizures. It's more severe, obviously, if you've taken the drug for a long period of time or a high dose. So it seems fortunate that the complications of coming down off of Valium or diazepam are less severe than drugs with a shorter half-life, drugs like Xanax or lorazepam. Well, we find withdrawal in somewhere between about a third and a half of the people who've been taking the drug for as short as a period of time as about a month. People should gradually discontinue the drug. But even after you gradually discontinue the drug, even if you do everything right, you're still going to have cognitive problems that can persist for somewhere between 6 and 12 months after you stop taking the drug. So when you stop taking the drug, you ought to slowly come off of the drug depending on the dose, depending on the amount of time, depending on the individual. But it should take somewhere between maybe about 12 weeks and half a year to come off the drug. But it's especially problematic in people who are either alcohol or drug dependent or people who have the borderline personality disorder. And there are some precautions when you take other drugs that can interact with the central nervous system. You don't want to do too much depression of the central nervous system, so be careful when you're taking the anticonvulsants or the phenothiazines, drugs like Zyprexa or Abilify, or you're taking an opioid narcotic or a barbiturate, or if you're taking an MAO inhibitor, an antidepressant. And especially caution is necessary in people who have suicidal tendencies. Now, the dose ranges anywhere from as little as 2 milligrams once or twice a day up to about 10 milligrams several times a day, depending on the underlying state. So, for instance, with acute alcohol withdrawal, we might need on the first day somewhere around 10 milligrams 3 or 4 times a day. Then the second day and third and fourth, then the drug is cut down. Muscle spasm, again, use the drug anywhere between a dose of 2 milligram, 10 milligram, 2, 3, 4 times a day, depending on the severity of the particular condition. Now, the drug equivalents, 5 milligrams of Valium or diazepam, would be about the same as 3/4 of a milligram, 0.75 milligram of lorazepam, or 0.25 of Klonopin, or 10 milligrams of Restoril, or 0.25 of the Xanax or the alprazolam. Interesting story behind the drug. It was actually the second drug that was designed or invented by Leo Sternberg. Leo Sternberg worked for Hoffman La Roche in Nutley, New Jersey. The first drug that he synthesized was Librium. But diazepam, although it was approved in 1960, it wasn't released until 1963 after the Librium as a new, more improved version of Librium. Actually, it's 2.5 times more potent than Librium. Definitely has an improvement over the barbiturates, because the barbiturates had a very narrow therapeutic index. You take a little bit too much and you could be in coma. And the barbiturates were more sedating. But just as an interesting side note, Roche successfully marketed the drug, marketed Valium, because of an ad campaign that was conceived by the William Douglas McAdams ad agency. And that was under the leadership of Arthur Sackler. Now, you might know the name Sackler because of his 2 brothers, Raymond and Mortimer. Those are the Sacklers that brought you Purdue Pharmaceuticals. And Purdue Pharmaceuticals, of course, they're credited with beginning the opioid epidemic with the development of OxyContin. Now, there's some interactions that are important with the Valium or the diazepam. With all of the benzodiazepines and opioids, can cause respiratory depression. They work at different sites that control the respiratory rate, so both suppressed. You're in potential trouble if you combine the drug. You also have to be extra careful if you combine it with antipsychotic or other medicines for anxiety or sedation purposes. If you're taking a sleeping pill or a narcotic analgesic, or you're taking even a sedating antihistamine like Benadryl, or you're going under anesthetic, or you're taking the barbiturates or an MAO inhibitor, you're drinking alcohol. Even if you take an antacid is going to reduce the peak absorption of Valium by about 30%. Adds about 25 minutes, half hour, until you get the peak of the drug. And if you take a drug that's going to inhibit the drug metabolizing enzymes, the enzymes that the body uses to get rid of the Valium, well, then you might have an increase in the duration that you're sedated. Those are simple drugs like Prozac or cimetidine or Prilosec or tomipramate. And if you take a birth control pill, same thing is going to happen. On the other hand, if you take a drug that stimulates the drug metabolizing enzymes, the 3A4, drug like Dilantin or Tegretol or St. John's wort or rifampin, that's going to speed the body's ability to get rid of or to metabolize the Valium. So it might not be as effective. And also diazepam might block the action of levodopa if you happen to have Parkinson's disease. Well, if you overdose simply on Valium or diazepam, chances are you're not going to die. But you have a fairly good chance of dying if you combine it with some of those other drugs that we've mentioned. So in 1999, the number of fatal overdoses involving the benzodiazepines was only about 1,100. Now it's more than 11,000. A third of the opioid overdoses involve benzodiazepines, and 20% of the deaths from opioid overdose also involve the benzodiazepines. So overdose, symptoms anywhere from drowsiness to coma, might have some confusion or low blood pressure. More seriously, you could have ataxia, difficulty walking, decrease in your responses. You could have your muscles becoming flaccid, your blood pressure falling, respiratory distress, coma, or death. Obviously, those need to be treated. We have a drug that can block some of the respiratory depressant effects, but unfortunately, it is relatively short-acting, and the Valium is long-acting, so you need close observation of those individuals who have overdosed on the Valium, so that they can receive periodic doses. But unfortunately, the drug, flumazenil, well, that can lead to seizures. Now, the drug is addictive. If we look at the number of people who are admitted to the emergency room for non-medical use of drugs, about 30% involve the benzodiazepines, about 39%, almost 40%, involve the opiates. Now, 30% of drug-related suicide attempts involve the benzodiazepine, of which Valium is a member. The overdose increased about 7-fold since 1999. And interestingly, there are more overdoses with Xanax and Valium than there are with cocaine and methamphetamine. And remember, Valium was immortalized in the Rolling Stones hit song in 1999, Mother's Little Helper. Well, sometimes people buy their diazepam or Valium through online pharmacies, rogue online pharmacies. And these drugs may or may not contain the diazepam. And if they do contain benzodiazepines or diazepam or Valium, it contain more or less than listed on the label. Also can contain other substances, other potentially more powerful and addictive substances. So the illicit labs turning out the benzodiazepines, unfortunately, aren't consistent. So there's significant variation between batches. Well, in January of 2020, the FDA approved 2 additional forms of diazepam. They approved these drugs for use either as a nasal spray or as a buccal film, rub inside the cheek, put inside the cheek. And they're for people who have seizure clusters. Drugs addictive, as we talked about. Recreationally, it's used fairly frequently, especially to come down off of a stimulant. Addiction caused alarm in 1964 when middle-class women seemed to be the best customers of the drug. Well, in 1975, as a result of widespread misuse of the drug, it was labeled Schedule IV controlled substance, and sometime between 1965 or thereabout, 1980, the use fell by about 50%, but then it again skyrocketed. Well, if we look at society in general, the prescription for benzodiazepines has increased by about 70% between 1996 and 2013. And when people get prescriptions, they get prescriptions for more potent benzodiazepines, and they get prescription for about 3 times the quantity. So about 66 million doctor's appointments per year, the drug is dispensed. In other words, about 25 out of every 100 office visits. Now they're mostly refills. A third of the people, unfortunately, receiving the drug also receive an opioid. And we've just decided that it's a bad idea to combine the two. And here the doctors are writing for the stuff right and left. Well, the good news about Valium or diazepam is it's cheap. Now that it's come off patent, you can buy 30 of the 5 milligram pills for cash, anywhere between $9 and $17, or with a coupon for as little as $7. But if you want the brand name drug, you want to take Valium itself, cash it's $200, coupon is $173. So that's the story of Valium. It was a good anti-anxiety pill in its day, but we've gotten a lot better since the 1960s. Major problem with diazepam is that it lasts so long in the body. And at the present time, authorities are worried that too many benzodiazepines are being prescribed without medical justification. Obviously, if you're going to take a drug that's going to interact with your brain's function, you want to make sure that you really have a legitimate need. Because once you start taking the drug, unfortunately, it's pretty hard to get off. Anyway, thanks for watching. If you enjoyed the show, please tell a friend, consider subscribing so you'll be notified as we post new videos. I appreciate your interest. I'm Dr. Ken Landau.